Treatment of the mentally ill. Back then, isolation was the preferred treatment for mental illness beginning in medieval times, so it's no surprise that insane asylums became widespread by the 17th century. Overcrowding and poor sanitation were serious issues in asylums, which led to movements to improve care quality and awareness. Like most things your income affects, your placement in society and being mentally ill and poor is never a good thing. This led to secondhand medication, people being more likely to be placed in a brutalist architectural mental facility. There's a higher chance that your help group gets discontinued due to funding. One example of Arthur's descent into madness is because the city couldn't afford to give him the treatment or help he needed. State psychiatric. It has brutalist architecture, raw concrete, practical with minimal design, fortress look-alike. It has housing, shopping centers, institutions, and educational buildings follow the same patterns. Supporters believe that a brutal but functional space motivates patients to leave, and some psychiatric centers even use shock therapies to make the patients leave faster. The Joker movie has two scenes that take place in a social worker's office, and in the latter scene, Arthur Fleck is informed by his social worker that the budget for the office has been cut and that this will be his last appointment. After this, it's revealed that he no longer has access to his medication. News headlines constantly have stories about mental health cuts, and these cuts have real effects on mental health facilities and the people who need them. These real-life budget cuts have similar effects as the ones coming from the movie, with these effects being that mentally ill people lose access to counseling and they may even have to pay for their medication themselves. If a mentally ill person is poor, then they may be unable to pay for the bill of their medications, causing them to have to go without. The Joker as a person. Contrary to popular belief, the Joker is not a bad person. He wants what everyone has in life, but due to his mental illness, society doesn't allow this to happen. His condition is called pseudobulbar. The symptoms are uncontrollable laughter and or crying. These symptoms usually cause public humiliation, depression, and social isolation. Medication can help with it, but there is no real solution to this condition. An example of how mentally ill people are treated by strangers is in the Joker movie when, during a scene where Arthur is taking a bus home, he notices a little kid who is just crying. He tries to make the child laugh, to which his mom yells at him and tells him to stop. While he tries to explain that he wasn't bothering her kid, his laugh starts up and he can't talk, so he hands her a card explaining his condition, to which she ignores and tosses to the ground. This is a fairly accurate example of how mentally ill people are treated by strangers. While not everyone will treat someone with obvious conditions like trash, many people will actively ignore them and stare at them subtly. The fact that ill people are treated as social outcasts very often make it harder for them to find treatment and may even contribute to their condition if they have something like depression. The Richardson Complex. It's very expensive, beautiful landscaping. The halls have wide corridors for social gatherings. It's very homely and there's marble floors. Supporters believe that creating a beautiful, inclusive environment would help heal mental illness without medication. In the current day, psychotherapy is a therapeutic treatment of mental illness provided by a trained mental health professional. Psychotherapy paired with medication is the most effective way to promote recovery. Examples of this include cognitive behavioral therapy, exposure therapy, and dialectical behavior therapy.